Hi everyone. So for warts, a lot of you have tried all the over-the-counter things. Dr. Scholl's, various salicylic acid patches, acids, you try to scrape them yourself. In the end, if you can't get rid of the warts, you come and see a dermatologist. In this particular setting, there are a couple ways that dermatologist offices like to treat warts. There are actually many different ways, so don't give up. When you come in, the most likely treatment is number one, freezing or cryotherapy. We use liquid nitrogen to hit the wart, almost giving that area a little frostbite, which then causes the area to die off and scale off in about 2 to 3 weeks, depending on the area and how thick the skin is. Oftentimes, this does require multiple sessions, depending on the location, to get you your desired result, which is in the end clearance, including getting rid of the roots of the wart. If you do leave any part of that wart, it will grow back in full. So make sure that you follow up and continue to treat the wart until your dermatologist tells you that it's completely gone and it's safe to discontinue your treatment. The second most common option is people will sometimes burn the warts. And this is burning or lasering, which some people refer to. And this is actually electrodesiccation or using an electric needle to really heat it up and causing a little scab to form. Not everyone does this, but sometimes it's helpful for those tiny little warts, and it's best done with a mask on because it can aerosolize some of the wart particles. Third, you can actually treat warts using various lasers. A lot of these lasers are either ablative lasers or they actually treat the underlying blood vessels that are feeding the wart. Okay. Fourth, removal. It can either be a shave removal or sometimes you can do an actual excision to carve out the entire wart. And this is especially done when warts really are not responsive to other treatment modalities such as freezing or burning. There are also some other topical lotions or creams or even injection options that are available. Some of these include cantharidin, which is a blister beetle juice, and this actually causes the skin to kind of blister off, and that's a kind of nice way to do it. It's painless, but it doesn't always work because it doesn't quite get deep enough. The other topical cream that's often prescribed is called imiquimod, which is a cream that induces your own immune system to recognize the wart and attack the wart. Again, it doesn't work all the time, and so it really depends on the person. And lastly, the injection is called Candida antigen. What this is that it requires your provider, your dermatologist, to inject some of this compound into the skin. It's supposed to induce a pretty strong reaction where immune system is gonna recognize the wart and attack all the warts that you have. So this is especially helpful if you have areas of tons of warts and you don't want to treat them, each of them. Sometimes a couple rounds of this Candida antigen can cause your body to actually attack all the warts, even the ones that are untreated by the Candida antigen. So please, this is the way to treat warts. Make sure that you do see a specialist if you're having trouble getting the warts, because a lot of the over-the-counter stuff, if you overuse it, can actually cause damage to the skin or lots of irritation. Thanks for joining me. For more tips, please follow my channel.